Have you ever taken a sip of cold water after trying a teeth whitening product and felt like someone zapped your tooth with a tiny lightning bolt? Yeah, that's not normal. And honestly, that's not your fault. The problem is, most whitening products out there, they were not designed for sensitive teeth. They were designed to look good in commercials. But here's what's wild. You can get bright, white teeth at home even with sensitive teeth. You just need to know the right method. And today, I'm going to break that down for you, scientifically, practically, and honestly. So if you've ever given up on whitening because of pain, or if you're scared to even try, stay with me. This video is literally made for you. Why sensitive teeth are different. Before we jump into the methods, let me quickly explain why sensitive teeth react badly to most whitening products. Because once you understand this, everything else makes total sense. Your teeth have 3 layers. The outer layer is called enamel. That's the hard protective shell. Underneath that is dentin, and dentin has tiny microscopic tubes called dentinal tubules that connect directly to your tooth's nerve. Now, when your enamel is thin, either naturally or worn down from acidic foods, harsh brushing, or yes, harsh whitening products, those tubules get exposed. So when anything cold, hot, sweet, or chemically strong touches your tooth, it travels straight to the nerve. That's that sharp shooting pain you feel. Most over-the-counter whitening strips, they use high concentrations of hydrogen peroxide, sometimes up to 14%. That chemical penetrates the enamel aggressively and irritates the nerve. For someone with already sensitive teeth, that's a recipe for serious discomfort. So the solution is not to avoid whitening entirely. It's to use gentler, smarter methods that whiten without destroying your enamel or shocking your nerves. Method 1. Desensitizing toothpaste first. Method number 1. And this is actually a prep step that most people completely skip, is using a desensitizing toothpaste for at least 2 weeks before you start any whitening routine. Now, you might be thinking, why is toothpaste the first tip? Because honestly, this one step changes everything. Desensitizing toothpastes contain ingredients like potassium nitrate or stannous fluoride. What these do is essentially calm the nerve inside your tooth and temporarily block those dentinal tubules we just talked about. Think of it like putting a little shield over your tooth's nerve endings. Use it twice a day, morning and night, for about 10 to 14 days before you start whitening. Some people even rub a tiny bit directly on their teeth and leave it on for a few minutes after brushing. That extra contact time helps it penetrate deeper. This isn't just a tip, this is a game changer. Dentists actually recommend this to patients before professional whitening treatments. You're basically doing what the pros do, at home, for free. Method 2. Low concentration whitening. Okay, method 2. If you want to use a whitening product, here's the key. Go low and slow. For sensitive teeth, look for products with 3% hydrogen peroxide or less, or switch entirely to carbamide peroxide-based products at around 10%. Carbamide peroxide breaks down more slowly than hydrogen peroxide, which means it's gentler on your enamel and way less likely to cause that sharp pain. Some specific things to look for on labels. 1. Whitening toothpastes with low abrasion formulas and sensitivity protection built in. These are a great daily starting point. 2. Whitening strips labeled specifically for sensitive teeth. These exist. Brands like Sensodyne have whitening options, and some strips are designed with lower peroxide levels and shorter wear times. 3. If you're using trays or strips, don't leave them on longer than instructed. I know you think more time means more white, but with sensitive teeth, overstaying causes inflammation. Less time, more consistency. The rule is simple. Be patient. Whiter teeth in 3 to 4 weeks of gentle daily use beats painfully white teeth that you stop using after day 2. Method 3. Oil pulling. Now let's talk about something that's been around for literally thousands of years. Oil pulling. This is an ancient Ayurvedic practice where you swish oil in your mouth for about 15 to 20 minutes. The most commonly used oil is coconut oil, and there's actually growing research supporting its benefits. Here's how it works. Oil pulling pulls bacteria,
toxins, and surface stains from your teeth and gums. It doesn't bleach your teeth the way peroxide does, but it removes the yellowish film that builds up from food, coffee, and bacteria, which makes your teeth appear naturally brighter over time. And here's why it's amazing for sensitive teeth. It has zero harshness. It actually supports gum health and reduces inflammation, so it's literally whitening while healing. How to do it? Take 1 tablespoon of coconut oil, swish it around your mouth for 15 to 20 minutes. Do it in the morning before you eat or brush. Then spit it out into a trash can, not the sink. It can clog pipes. Then brush normally. Don't expect overnight results, but with consistent use, 4 to 5 times a week, many people notice a real difference in 3 to 4 weeks. Method 4. Baking soda. The right way. Next up, baking soda. Now, I need to address this one carefully because there's a lot of misinformation online about this. Baking soda, sodium bicarbonate, is a mild abrasive and a natural whitening agent. It physically scrubs surface stains off your teeth and creates an alkaline environment in your mouth that prevents bacteria growth. It's actually one of the most well-researched natural whitening agents out there. But, and this is important, people with sensitive teeth need to use it the right way. Do not use it every day. Use it 2 to 3 times a week maximum. Daily use can gradually wear down enamel. Do not scrub hard. Apply it gently in small circular motions for about 2 minutes. The best method, make a paste with baking soda and a few drops of water. Apply it with a soft bristled toothbrush. Brush gently, rinse thoroughly. Some people mix it with their regular toothpaste to dilute it. That works too. The goal is gentle, consistent application, not aggressive scrubbing. Used correctly, baking soda is one of the safest and most effective home whitening tools available, especially for sensitive teeth. Things to avoid. Okay, we've talked about what to do. Now let's talk about what not to do, because some of the most popular home remedies online can actually make sensitivity worse. Number 1, lemon juice or apple cider vinegar on your teeth. I see this everywhere. These are highly acidic, and acid directly erodes enamel. For sensitive teeth, this is one of the worst things you can do. It might remove some surface stains short-term, but long-term, it's damaging your enamel and making sensitivity permanently worse. Number 2, activated charcoal scrubs. Despite being trendy, activated charcoal is highly abrasive. It can scratch your enamel and cause microscopic damage. The American Dental Association has not approved any activated charcoal dental product. Use with extreme caution, or just avoid it entirely if you have sensitive teeth. Number 3, leaving whitening products on too long. More is not more here. Follow instructions strictly. Number 4, whitening too frequently. Even gentle methods need rest days. Whitening every single day, even with mild products, can gradually irritate your teeth. The bottom line, if something burns, hurts, or causes pain, stop. Pain is your body telling you something is wrong. Always listen to it. Bonus tips, diet and daily habits. Before I wrap up, I want to give you some bonus tips that most whitening videos never mention, because whitening isn't just about what you put on your teeth. It's also about your daily habits. Tip 1. Drink coffee and tea through a straw. I know, it sounds extra, but these beverages are major staining agents, and a straw minimizes contact with your teeth. Simple hack, big difference. Tip 2. Rinse your mouth with water immediately after eating or drinking anything staining. You don't always have time to brush, but a quick water rinse removes surface residue before it sets. Tip 3. Eat crunchy fruits and vegetables like apples, celery, and carrots. These are natural tooth scrubbers. They increase saliva production and physically help clean teeth as you chew. Tip 4. Stay hydrated. A dry mouth creates more bacteria and plaque buildup, which leads to staining and bad gum health. Water is genuinely one of the best things for your oral health. Tip 5. Use a soft bristled toothbrush. Medium and hard bristles damage enamel over time. Go soft, always. These habits don't cost anything, but stack them with the whitening methods we discussed, and you will see real, lasting results. Now, before I get to the final summary, I want to hear from you. Drop a comment right now. Tell me, have you ever tried a whitening product that hurt your teeth? What happened? What did you use? Because honestly, your experience helps this community. Someone watching this right now might be going through the same thing you went through, and your comment could literally help them. And if you found this video useful, please share it with someone you know who struggles with sensitive teeth. You'd be surprised how many people just give up and accept yellow teeth because no one told them there's a better way. Also, if you haven't subscribed yet, hit that subscribe button because we cover topics like this all the time. Real, research-backed health and wellness content that actually helps you in your real life. No fluff, no fake promises. All right, let's do a quick recap of everything we covered today. Start with a desensitizing toothpaste for 10 to 14 days before whitening. Use low-concentration whitening products, 3% hydrogen peroxide or less. Add oil pulling to your routine 4 to 5 times a week. Use baking soda gently 2 to 3 times a week max. Avoid lemon juice, activated charcoal, and over-whitening. Build daily habits, straw drinking, water rinsing, soft bristles, and hydration. That's a complete, science-backed, sensitive teeth-friendly whitening system, all at home, all affordable, and all without torturing your teeth. And remember, consistency is everything. You won't see results in 2 days, but in 3 to 4 weeks of doing this properly, people will notice. You don't have to choose between white teeth and comfortable teeth. You can have both. You just needed the right information, and now you have it. I'll see you in the next one. Take care of yourselves and those teeth.